Hey, what's up, good people? Dr. Brayo hapa, I'm back again.
Dr. Phil.
Hey, Gegobase episode 1 million.
Kwa sija kushow bro. Siku hizo nitanga Fanta Claus. Sijui nikwambia story. Nitanga Fanta Claus. Sijui kwa nini?
Mimi ni Sanda.
Wewe ni Sanda?
Mimi ni Sanda.
Fanta Claus. Yeah, so this is episode namba ngapi? Tumesonga.
1 million.
Oh, 1 million.
So now, today we are going to be discussing Gego and Gino. We have a prologue before how we came to write those books, what inspired us, So first, I'll speak for myself. It started back in 2016, nikiwa Coast General, during my internship. Sasa hiyo mwaka, let me tell you, Maina, tulingoa watu meno. Mtu anakuja kwa 24 years old, already lacking about 760. Hapo tunaongea mostly zile za kusaga, premolars, molars, probably one anterior tooth, yani anterior ni front, yani ya mbele.
Watu wanaanza mbele hivyo tu
like when ukiuma, that's the most common solution, guys. So that's how it started. And sasa what bugged me the most ilikuwa the fact that they didn't understand their other modalities of treatment. It's like they didn't know, and then when you try to explain to them, they just don't get it. They get fixated at the cost. So they never get to the value of that treatment. So ukiongea juu ya feeling, umwambie feeling ni tao, ilikoga public. Umwambie feeling ni tao, anaangalia tao. Kwambia mwanangu nina jero. Anyway, so it was impossible.
So the first point was financial concern.
The first is financial concern.
Hata hawajali
so it makes them not think about this other option. And by the way, I came to realize that even the public was more expensive than some clinics around.
Okay.
When it comes to extraction, kuna watu walikuwa ngoa 300, wajua 250. Sasa it's easier, it's faster, it's cheaper.
It's good riddance. Tumemazana hiyo.
Lauma. Toa. Sawa. Now flash forward, so I'm seeing this guy at now 30, 32. Now this guy wants replacement. Unajua wanakuja na frustrations. Now you
later on,
you can't even talk because una meno za mbele.
Aesthetics.
Crazy. So I started, ilikuwa inani disturb sana. So I started thinking, how do I get to these people? Because I've tried talking to them. It's like ukishakuwa adult, ushazoea a certain way of operating. It is very, you can't teach old dogs new tricks.
True.
So they just stuck at the money, and then by the hustle ni hard. Hata sai dog mazen kikombea root canal 15k.
Antafikiria mara mbili.
Utafikiria twice. I mean, sometimes even us doctors may not be able to afford your treatment.
True.
So that is how it started. Now at the same time, we do rotations across all departments of dentistry. Then now I got to pediatrics. So in pediatrics, I realized something. Mtoi akiwa sick, the parent will do anything. Anything, because this is it's not you, then it's a small you, and you love that person unconditionally. So you'll do anything. So those ones, ukimexplainia the problem the kid has, because the parent understands, and then the kid also understands. Pole. Mosquito bite, tatoa dudu, nini, story mob. So as I went on working with the kids and the parents, nika realize that is the best place ya kuanza hiyo program ya awareness. And that is why I remember that day when we were discussing at your place. I even had the name of the book, like ilikuwa tu kwa kichwa. Thought about Gego for very long
time.
So it is something. Sasa getting to the kids first. Let the kids understand what dentistry is all about, how important their teeth are, and you know the value they give, and the value, you know, when you lose that, ukisha lose your meno, that is when you start understanding, oh man, siwezi tafuna, ama when you start feeling pain, oh ningeenda cleaning mapema, I would have done these feelings, etc. Yeah, man, basically.
Yeah.
That's how I got to.
So I think mine is not far off from what you are saying, eh? But I'll start kuna msemo wa Kiswahili unasemanga samaki mkunje angali mbichi, yeah? Now my story way just starts differently, yeah? Male start rotations, okay? I think I really enjoyed my pediatric
So this is now in
both. Now let me tell you.
Undergrad now.
Undergrad. I really found like the gist, and I really enjoyed pediatric dentistry back in campus, okay? And then now where it got even better, where I went for my internship now in KNH. Now come me, I love pedio rotations. Hata kuna doc moja mi upenda tu sana hiyo console to Dr. Ireri Salome. That lady maze. She made it simple and you know, this is how it starts. Let me tell you. When you get somebody who enjoys what they do, umepata zile rotation makonso wanakujanga wote, all consultants are hands-on, and they will leave even later than you do. Shiko nanipata.
Afu unapata hata konso wanakuja hapo, makonso wengine wa rotation zingine wanakama.
Like cheki, it's all about the consoles loving what they are doing, okay, and even showing you like, check, I love what I'm doing. So me, after I had my pediatric rotation in Kenyatta, I really enjoyed pediatric dentistry. And now, that now brings me now to why I really thought about Gego and Gino, okay? As you were saying, when now most parents are bringing their children, there were those uninformed, like who you experienced back ukiwa Coastal, okay? They are not well informed because yes, mtoto akuja na baby teeth, okay? Anaambia mtoto wangu meno yake tu yameharibika. Hajui ya vitu kama basics like ukilalisha mtoto hafai kuwa na ile maziwa feeding bottle kwa mdomo, hafai ati kama ni hiyo whatever juice unampatia asila nayo kwa mdomo, okay? Also, they actually don't have basics like mtoto hafai kusafisha meno. Watasema hiyo meno ati sitangoka. Hiyo meno itangoka. Such perceptions,
yes, sure.
And now you see, you start relating like huyu tukimwelezea na mapema ata carry forward, okay? Mzazi tumweleze, mtoto tumweleze. Now going now to Gego and Gino, where we cover about how the dentist handles the child. Most children are anxious. They have fear, phobia, because of this thing I usually say often. Mtoto usipokula nakupeleka kwa daktari ufanye nini? Udungwe sindano. Now wanatuharibia, unaona? And now we have not to demystify and tell them, listen, when you come to a dentist, that should be a list of your phobias, okay? We'll manage you, list of pain, your anxiety will calm you down, and we'll do the best procedures to the best of our capability. So that is why we talk about even the tooth fairy, where the tooth fairy comes in. Tooth fairy. Like we try and tell you like it's not something to fear about. It's a natural process. Yes, you're shedding many natingika. What do you expect? Pesa chini ya pillow. But actually,
if you're watching this, ukingolewa meno, milk tooth, you'll get money under your pillow in the morning.
Wazazi ni economy watu kupenda sana.
Wazazi ni wacheze kama wao.
So you see, because now why are we telling you that you're going to get an award for losing a tooth? It shows that you're growing. It's a story that telling you, yes, you're losing your milk teeth, but your adult teeth are coming. It's part of the growth curve. So my passion came from mostly how I experienced the rotation, how I experienced handling kids, and also I felt how watoto tukiwaeleza saa hii they shouldn't fear the dentist, come for dental review. There are many other things we can do. Like even the next edition we are capturing a more mature crowd or an elderly crowd.
You will to the teenagers.
Sasa now we are going to capture in depth even more procedures. So you see, so the whole point is inform the public. An informed public is quite a strong public. They have unasemanga information is
it's power.
It's power.
No. Now actually the major goal of targeting the kids is we now want to change the generational misinformation that has been there for years. So you tell the kid learns, the kid grows with the information. You keep treating them at various stages of their life. So by the time this kid is like year 24, instead of having lost 6 teeth, they will have the 6 teeth with them.
Intact.
Maybe root canals,
fillings,
crowns, they are still there. So this kid at 24 upwards, this kid can now get a kid. So you can imagine the care they're going to give to the the next generation and on. So in future, we don't even want guys to go, right now guys are, being treated by quacks everywhere. We want them to get to a point where they just look for specialists. Your tooth is aching, unatafuta endodontist, you know them. You have some malaligned teeth, you go get an orthodontist. Like that level of
you appreciate treatment.
Yes, that level of information amongst the public, and it's the only way.
And Doctor, I've picked something. We only need to influence one generation.
Yes.
One band. I'm just giving an example. We are that band. Let me talk of us as that band. That kuna wale wazai wetu na watoto wetu hapa nyuma.
Sisi wenyewe tulijua tukiwa.
Yes. So now, with our band, we should not pick up the old phenomena that were carried forward. We break that chain. But now with our coming generations, we now feed them with the right. So we just need to work on one generation. You see, nyi ambao mna watch pale, you are the generation that we are talking about. You are elite, you are knowledgeable, and you have the information.
Cool.
Yes. Okay, guys. So these are our editions. We have Gego the Tooth, Gino and the Tooth Fairy. Place your orders. Contact us. We do have both hard and soft copy, isn't it, Doctor?
Yeah, okay, mostly hard for now. Soft inakam. Itapostiwa kwa website.
True.
Yeah, we also want to thank our publisher, Publishing Consulting KE and Daraja Books for the support that they have given us through the years. By the way, we started this even before we started Gego Cared the clinic. So Gego came first. Gego and Gino came first. And we thank all the guys who have supported us, the various clinics within the country.
Nationwide.
And then there are various individuals who've done the same, bought for their kids. We thank you guys. Keep it locked. So there are more editions coming.
Yes.
Nimoto. So we're doing pre-teens now. We go to teens all the way up until we get to you adults. I know you're waiting for you as uzito. But yeah, thank you for your support.
Tutahitaji kimeumana.
It has bited each other. Anyway, guys, so love your smile. It's the festive season, so Merry Christmas.
Happy New Year 2023.
Ha ha ha.
Peace out.